So, Dr. Chong, please tell us more about the situation in Malaysia in the areas of healthcare for the elderly, and the difference between the kinds of packages that's offered between a Bumiputra and a non-Bumiputra. What do you foresee also in the future?
Right. So at the moment, actually, there's no specific healthcare service for the elderly. Okay. So healthcare, what we've done is, as we had independence in '57. So over the years, what we've concentrated on really has been in public health. So infectious diseases, and then later into chronic disease management. And so in the last 40 years, you notice that the healthcare system has actually improved our major indicators, the WHO indicators, so lifespan, maternal mortality, neonatal mortality, etc. So all our indicators have now improved and are probably world standard. Now we're looking at, in terms of population health, we are now faced with chronic disease, so disease that's not so much infectious diseases, but chronic disease of the Western world. Okay? And so that's the big thing that we are having to tackle. So the hypertension, hypercholesterolemia, unfortunately rising obesity, and very high incidence of diabetes secondary to obesity. So because we're tackling all that, and the population of Malaysia above 65, about 4.5%. So total population is 28 million, about 4.5% over 65. We've really not got a strategy in place yet to look at specific healthcare needs. So if you look at Malaysian healthcare, most of it is provided by the public sector. So the Ministry of Health hospitals primarily, and outpatient clinics. And that's funded through general tax revenue. So on average, you spend about 4.5% to 4.8% of GDP on health, and that's across the board, from neonatal health right through to mental health and everything in between. The question now is how much of that burden of healthcare expenditure should be taken up by the private sector. And so last year, under Najib's government, there's a huge plan now to get our economy going. We were one of the Asian tigers, but we let other countries get ahead. So the whole idea is for us to move towards developed nation status with all that entails. That means your per capita income has to go up, standard of living, value add, knowledge, skills, etc. And as we've gone up, so last year when we looked at health, the health sector as being a potential driver of the economy, we looked at elderly living or seniors living as a potential business driver, actually as an economic driver, because it said that there's the component of real estate, component of financial investments, insurance products, etc., and then the service provision. So we're actually now starting to pull that together into some sort of framework. If you look at the private sector, most of it is funded either by out-of-pocket payment or by third-party payers. So third-party payers would be medical insurance products that individuals buy, or that corporate companies buy on behalf of their staff. And these medical insurance products are the ones that actually driven a lot of new market segments into the private healthcare. But if you're looking at the Bumiputra population, actually a lot of those insurance products were not open to the Bumiputra population because they didn't quite comply with takaful and Islamic financing laws. So it's only just recently that a takaful insurance has come out, which actually then means that we've opened up this private healthcare sector to the Bumiputra. So in fact, contrary to expectation, actually the Bumiputra population has actually probably been disadvantaged up to now. for the full insurance, I think, was just launched earlier this year.
So what do you see in the future of the aging population in Malaysia, and how much that's going to be done by the Malaysian government as well as the public sector?
One of the first things that the Ministry of Health did, it launched the Private Healthcare and Facilities and Services Act in 1998, and the regulations came out in 2006. And for the first time, nursing homes are regulated, so that to be registered, they have to comply with physical standards, etc. And then the patient quality body, which is the Malaysian Society for Quality in Health, MSQH, has now put out standards as well for hospitals, clinics, nursing homes, so that in fact, see, up to now we've had kind of mom and pop nursing homes in bungalows and in shop lots and in houses that haven't been really at all regulated. So that's coming in. So the infrastructure in terms of policies and requirements is just coming in now. Then the national the economic transformation program is the one that will be responsible really to look at how to make this sector attractive to private investment.
So affordable healthcare as well as living standards in Malaysia, can everyone be able to afford and able to be provided for, even though if they lose their homes?
See, at the moment, if you need healthcare, it's practically free in the public sector. So anybody can access healthcare, and you pay a very nominal fee.
Even for housing as well?
This is for health services.
I see.
Inpatient and outpatient.
Well, thank you, Dr. Chong, for your kind time and interview with us.
You're welcome.